Thank you. Good evening, Chairman McCarthy-Vahey, Chairman Anwar, Senator Summers, Representative Claritas Detria, and other members of the Public Health Committee. My name is Dr. Alan Weiner. I'm the Chairman of Emergency Medicine at Stamford Hospital. I've been in that role since 2018. I've been a practicing emergency physician in Connecticut for almost 30 years. I'm here tonight to testify in opposition to Senate Bill 1067. I'll limit my comments to the part of the hospital that I'm most familiar with, which is the ER. While I have no doubt that the proponents of this bill have good intentions, I can tell you from my own experience as a practicing physician, negative consequences are foreseeable if nurse staffing ratios are mandated in the ER. Unlike other parts of the hospital, patient volume and acuity in the ER is predictable. I agree with many other people who've testified today that a nurse managing a critically ill patient is not going to be able to manage many other or sometimes no other patient at the same time. Most patients in the ER, however, are not critically ill. There will be times when nurses in the ER will need to manage more than 4 stable patients at any one time, as is mandated by this bill. With the conditions in the ER constantly changing, it's essential for us to be able to be flexible to meet the needs of the patient at any given time. Adopting inflexible staffing rules will hinder our ability to be nimble and to shift resources to where they're needed the most. I urge the members of the committee to leave decisions on staffing to clinicians and nurses at the bedside who have the training and experience to delegate those resources, including these nursing resources, to where they're needed the most. Second, from my own experience of knowing how the ER works, I can foresee delays in all aspects of ER care if mandated ratios are enacted. It will take more time to bring patients in from the waiting room if nurses are limited in how many stable patients they can manage. The bill also has the potential to delay the transfer of patients out of the ER. You heard earlier from a speaker who talked about the experience in Massachusetts in getting ICU patients up out of the ER. I could see the same thing happening to patients who need transfer to the operating room or to interventional radiology or some other part of the hospital. Can those patients safely wait until a nurse can be found in that unit to satisfy mandated staffing ratios? I'm not sure that will be the case. In closing, let me say that patient safety is at the heart of what we do as healthcare professionals. From my 30 years of working in Connecticut emergency rooms, I do not believe that mandated nursing ratios will equate to improved patient safety and actually has the potential to delay patient care. For these reasons, I ask the committee members not to support this bill. Thank you.
Thank you, Dr. Weiner, for your time, for sticking with us, as so many have today, and your testimony, also for your work in the emergency department. As I said to the last person who testified, all of you have been on the front lines, especially these past few years. You have our thanks and respect.
Thank you.
Seeing and hearing no questions, we're going to go next to, I'm going to